So today we're here with the South Florida Business Journal and Comcast, and we're having a health tech panel, which is basically 5 panelists that are going to be speaking about technology today. We have the Dean from FIU Medical School. We have a Vice President or Medical Director from Holy Cross and Trinity. We have the founder of Derma Sensor, and we have a veterinarian from a very large veterinarian group speaking on health technology. And of course myself, Dr. Herzog, practicing for 15 years and the owner of Implant Center of Miami. So today's gonna be a fantastic day. Lots of new insights. We're talking about AI, we're talking about 3D printing, and we're really gonna get into the core of what is missing and what we can adopt right away.
Hi everyone, I'm Dr. Tatiana Herzog. I'm a general dentist and I have 5 locations here in South Florida. I'm the owner of the practices, and also a dental lab, which is a big part of technology. And I've been practicing for 15 years. I would say I'm a serial entrepreneur and an early adopter of technology. And so I have lots to share with you guys today.
If you were to describe current healthcare technology in one word, the current state of healthcare technology in one word, what would it be and why?
So I would give it 2 words, transformative and accelerating as well. And, transformative, we're seeing all the changes. It's going to be disruptive. We're going to have to adapt quickly. And that's the accelerating part of it, right? So every 30 days, every 90 days, I'm getting updates for the technology that we're using, and we have to adapt to it. So that's my 2 words.
That's a good point, and you have to adapt. You could be left behind, right? So how do you support clinicians so that they don't burn out with all these new technologies?
So the first thing is, going back to what you said, is you bring the clinicians to the table and you explain the technology, get their feedback first. And the next thing I always do is I pilot it myself. So just like they'll bring it to a smaller division in the hospital, I'll actually test something myself. I have a few gadgets here also for you to see. In dentistry, a big thing is we do a lot of implant dentistry. And so these are called surgical guides. So this is a model of the patient's mouth. I know not everybody can see this, but you can check it out later. And this would be a very complicated implant surgery. So how do we make it easier for the clinician? And easier means less stressful and more predictable outcomes. So we do a computer-guided surgery. We basically plan the surgery on the computer, and then we print a 3D model, and then we print something called a surgical guide. And then we just snap this right over the patient's teeth during the surgery, and now our drills go exactly, precisely where we wanted them, where we planned them, so that the teeth then look great in the end, and it's a predictable outcome. But to get to this point, from where it started, because now guided surgery is probably about 10 years old, although it's really with 3D printing accelerated. To get to this point, we had to troubleshoot quite a bit. And, we would bring it to some clinicians and they would hate it. And we're not using that. We can do it freehand just fine. I've placed 1,000 implants. I've placed 10,000 implants. And I still trust this way more now, because this is planned, a predictable outcome. And so I think that adoption does take time. As far as burnout goes, once you get to that point where you have that predictable technology, that's going to decrease burnout significantly and decrease stress for our clinicians significantly if they know what their outcome is going to be. They can see better. In dentistry, at least, the biggest thing would be now, yes, AI with diagnostics. We have the x-rays up and they are now circled. The caries are circled for the patient to see it and the clinician to see it. Incidental findings are found much quicker. We can see bone loss quickly. And so we can also train our doctors to see things faster by using these platforms. So, there's a company called Overjet, there's another one called Pearl, and you put the patient's x-rays up on the computer screen and it will highlight all of the defects in the tooth or the bone loss or any kind of pathology that it sees. And so that's great for training. But then on the other side of it, now we have this whole, for dentistry, it's a lot about 3D printing, and AI goes with that. So like to make these teeth, for example, we used to have a technician that would sit there and draw them out on CAD. But now the AI has all these just libraries that it uses and puts the best one in for you. So the tweaking is maybe 5 to 10 minutes, and then we can just go to print. But our clinicians have to learn that process as well. And so that is a little bit of a difficulty that we're having because of the speed and the acceleration of these processes. Wouldn't it be great if you could see your results at the end instead of, just trusting that the dentist is going to get you where you want to be? Or when the dentist told you, don't worry, it's going to get worse before it gets better. It's either going to get a little bit more crooked and then they're going to line. Well, there's an app now and you can see that on aligner number 4, your tooth is a little crooked, and then by number 6 or 7, now it's aligned again. So having that access is going to reduce anxiety from the patients. I think the patients want this information at their fingertips. And then the other part of it that you mentioned about booking your appointments online. So we actually have been, I don't want to say resistant because that's not the right word, but the patient-facing AI, especially the calling, the AI voice calling, and them taking the appointments and booking the appointments on our system. We haven't done that yet because I feel that it's just not quite there, the patient-facing. Can I just see like a show of hands of, if you guys called your dental office, how many of you would feel comfortable making an appointment with an AI receptionist? Interesting. Maybe half?
Yeah.
That's a big point.
30% maybe? So now, what if you, it's okay, I asked it. I still get some information from you guys. So now, if you called your dentist office and you had a loose tooth and you asked, I'm in pain, what do you think it is? And the AI receptionist actually answered a clinical question. At that point, would you feel comfortable? No. So booking an appointment is okay, but go ahead and use a temporary cement from Walgreens to re-cement your crown is not okay. Did my marketing team jot that down? And then the last part of that is now when they're calling our phone system, starting next week, the calls will be recorded and then documented into the chart system. So if you do call and you say, hey, I've been trying to get in touch with my dentist, Dr. Herzog, I have pain in this tooth, could you please call me back? And maybe that message doesn't get to me. When I look in your chart, I will see that you called. And I'll know, and I'll be able to hold the receptionist or whoever took that call accountable, which is, I think, is really important for training. So that's the third part of this that I think it really hits home. The price of this full mouth of teeth used to be somewhere around $40,000. It's gone down to about $20,000, and it's continuing to go down. Implants used to be $4,000 for one tooth, still are in many practices. We disrupted the market and did it for $1,789 because we could, because we have the technology. So right there, you have like a very clear example. Dentistry is usually not covered very well by insurance. So these are procedures that are necessary, and we have to bring the price down to get to the middle American people, the people who are, not taken care of by the government, and then the people who aren't, basically living with all this extra money.